morning. My name is Laura and I'm going to be your nurse for today. Can I please have your name and your date of birth?
Yes, it's gonna be Mary Blair. My date of birth is June 17, 1998.
And it matches her bracelet. I go ahead and perform hand hygiene. So I verified her orders. I verified that she has the consent form, and I did take her vitals. Okay, ma'am. So today your doctor did order a blood transfusion, and I do see that you have the consent form here. Do you have any further questions about it?
No questions.
Okay, so what I'm gonna do is I'm gonna set up everything right now. After I set up, I'm gonna go ahead and pull out the blood, and then we'll start with the transfusion. So don't mind me. Okay, so I'm gonna go ahead and put on my glove. Well, I'm gonna hang the bag first. So I'm gonna go ahead and hang my normal saline bag. Okay, and it would be filled out. I get my tubing, and this would be the white tubing. Okay. So then I would make sure that all of the clamps are closed on the tubing. This one has really different one because I'm using two different IV sets, but so I would close all of the pumps. I make sure they're all closed, all of the clamps, I'm sorry, and they are closed. So then I would get one of the ends and spike the bag. Okay, and the clamps are closed. This one would go on a safe place, and then go ahead and put on my gloves. Do you feel any pain on the IV side or anything, ma'am?
No.
Okay. So I would check the IV side. I'm checking that it's there's no infiltration, no phlebitis, there's no pain and no redness, nothing. I do get this would be a new flush. Go ahead and open it. Well, first I have to clean the port. So I go ahead and get an alcohol swab. I clean the port. Dispose of this. I wait for it to dry. Once it's dry, I get my flush. Pull back and then up. Connect. And I pull back to see if there is blood return, to see if the IV is patent. So I did get blood return back. Remove this. I dispose of it. This. And then that is done, I unclamp this tubing, but make sure the other one is closed. So I would unclamp this one and then prime my tubing. So then I would only unclamp that side of the Y. Once it is primed, I would go ahead and connect it to my patient. Okay. And then I would go ahead and set the machine to about 5 milliliters an hour. Take off my gloves. And then I would perform hand hygiene. And get a new pair of gloves so that I could go ahead and take them down when I do get the blood. Okay, ma'am, so I'm gonna go ahead and grab the blood. Do you have any questions for me?
No.
Okay, thank you. I will be back. Perform hand hygiene, and I would leave the room. Okay, so here I would be at the blood bank. I have my blood slip, and I would check that I need a pack of red blood cells. So I would come on, I would knock, and then, hi, my name is Lauren. I'm here to pick up Mrs. Johnson's blood.
Yes.
So then I would put on my gloves. And then, thank you. I take the blood out. Okay, and then we would verify. So the blood is for Mrs. Johnson Blair. Her date of birth is 7/11/1963.
Yes.
MR number is DS112599. Blood bank number is T888970.
Yes.
Blood type B negative. Donor blood type B negative. Unit expiration is October 24th, 2020.
Yes.
And the unit number is W689613147588. Okay, so then we have confirmed that we have the blood we needed, so the blood does go back inside the bag. This would be a biohazard bag. And here, we would put the date, the time, who it is issued to, and the text name. And then I would get the bag, put this, get the blood, put this slip in the bag, and then I would head back to my patient's room. So I come back to my patient's room. I already have the blood. I remove the gloves, the previous ones, perform hand hygiene, and put on new gloves. Also, there is going to be another nurse with me, which would help me verify the blood that I'm going to be administering. Okay. And I will, of course, introduce myself. Well, no, tell the patient that I am back and verify her identity again. Okay, ma'am, so can I please have your name and your date of birth again?
Yes, it's Johnson Blair, and it's June 17, 1997.
Thank you, so she does match. And then now I will get my blood. And with another nurse, I would verify all the information, which would be the patient's name, date of birth, MR number, the blood bank number, patient blood type, donor type, expiration, and the unit number. We would do that with the blood slip, and me and the other nurse would be doing it together. After that is done, I'm gonna go ahead and hang my blood bag. Okay. And then what I would dispose of this. And then I'm gonna disconnect my patient. So I'm gonna go ahead and disconnect this from you, ma'am. I'm just gonna go ahead and get everything ready for your blood transfusion. So once this is disconnected, I make sure I open the port. And I will slowly be opening the bottom one. And I would open it to back prime this port. So once it is primed, there is no bubbles or anything, it's ready. And I would close this one. And then I make sure that this one is clamped as well before. And then I go ahead and I spike my bag. And I connect to my patient. And it kind of dripped from the back, but it's because the bag. Okay, so if I did have this, I would perform hand hygiene and I would change out my gloves. So then now I have this connected. I have my blood. Everything's primed. What's next? The ports, patient's connected, I back primed. See that there was no bubbles. Okay, so then once she is connected and everything, I do start my IV. So I would do the math to see how much it would flow, what the flow rate would be, I'm sorry. And then of course I would stay with my patient for the first 15 minutes of the transfusion, constantly observing my patient to see if there's anything wrong happening with it. I would take vital signs prior to the blood administration and after the blood administration, after the 15 minutes. And then after the 15 minutes, I would perform the hand hygiene, take off my gloves, and let the patient know if they have any questions or if they feel anything to let me know. And I will come back in an hour to see how she's doing after the first 15 minutes. I would remove my gloves and perform hand hygiene.